Well, you might not be aware that diabetes is the leading cause of blindness in people as young as 20 years old. Oftentimes, people don't even know they have diabetic eye disease. And November is Diabetic Eye Disease Month, and Dr. Richard Edlow from Katzen Eye Group joins us this morning to talk about this. So a lot of people who have diabetes don't realize that they have a disease.
It's pretty incredible because there are no symptoms frequently, and the estimates are there are about 29 million people in the U.S. over the age of 20 diabetes, and it's thought that about a third have no clue. So it affects about 8% of the U.S. population. A third are walking around never having any idea. Frequently, we pick it up during an eye exam when they never had any idea.
If you're diabetic, does that mean you automatically will have diabetic eye disease?
Not at all, and there are 5 very important things to keep in mind if someone has diabetes to lessen the risk of having any complications from the disease in the eye. And one is, the first most important thing is having an annual dilated eye exam where the pupils are dilated for the doctor to take a good look in the back of the eye. And others are certainly keeping really good control of your blood sugar, exercising regularly, quit smoking, and if there's high blood pressure or high cholesterol, controlling those. Those 5 steps will minimize the risk of ever having any of these complications.
So what can happen to you if there's no symptoms, if you don't know anything's going wrong?
Yeah, it's pretty interesting. Frequently, a patient will present to the eye doctor with a big change in their vision. All of a sudden, things are blurry off at a distance or whatever it may be. And that can be, that's the mildest form of diabetes affecting the eye, where it can make someone nearsighted who was never nearsighted before. That's a temporary phenomena. Once the blood sugar is controlled, the vision clears up again. The more serious things are fluid accumulating in the back of the eye, back in the retina. There's what's called diabetic macular edema. And so fluid will accumulate in the back of the eye, and that will certainly affect someone's central vision, that 20/20 straight ahead vision. And then more serious to that is that there are new blood vessels that grow in the back of the eye, and those blood vessels are very leaky, and they can leak blood and protein and fluid into the back of the eye, and that can have devastating consequences. If we catch it early enough, it can be treated. Frequently, with the fluid back there, there are new treatments that include delivering medication directly into the eye. They can improve things. The most important thing for anyone who has diabetes is getting that annual eye exam.
So you just have to consider that's one more way to monitor your health. If you are a diabetic, then you should routinely make sure you get an annual eye exam.
Absolutely.
And stay on top of it.
The primary care doctor following the patient with diabetes, one of the recommendations will always be having that annual eye exam. And we see people go without having it done for years and years, and the consequences can be pretty devastating.
If you don't treat it, is it permanent?
It's typically the vision loss can be permanent. There are new treatments, however, that actually can improve upon some vision loss, and it's all a matter of how far it got to whether or not it can be reversed. But there are cases where it can be reversed.
Terrific. Dr. Edlow, thank you for coming in today.
My pleasure.
Explaining it, making us all aware of it. One more thing to watch out for.